Let's break down this question stem. We have a 65-year-old patient presenting with recent onset cognitive impairment, myoclonus, abnormal behavior, and ataxia. This is a clinical picture of a rapidly progressive neurological condition affecting cognition, movement, and coordination. Now, the key feature here is the rapidly progressive dementia combined with the myoclonus. This should immediately make us think of a prions disease, more specifically Creutzfeldt-Jakob disease. So Creutzfeldt-Jakob disease is a human prions disease, and it's classically suspected in patients with rapidly progressive dementia, plus at least two of the following clinical features. So myoclonus, visual or cerebellar signs, pyramidal or extrapyramidal signs, and akinetic mutism. So in our case, the patient has myoclonus, cerebellar signs in the form of ataxia, behavioral changes which fit within the criteria for Creutzfeldt-Jakob disease. So now we look at the imaging. So the MRI shows high signaling in the caudate and putamen. This is a very characteristic finding in Creutzfeldt-Jakob disease. In fact, typical MRI findings include high signal in the caudate and putamen, or involvement of at least two cortical regions, such as the temporal, parietal, or occipital lobes. So combining the clinical features with the MRI findings, this is a clinical image highly supportive of Creutzfeldt-Jakob disease. Additional supporting investigations, although they're not mentioned here, would include the typical EEG changes, which involves the periodic sharp waves, or a positive cerebrospinal fluid assay, which will show increased 14-3-3 protein. So let's go through the other options. So Lewy body dementia, this would present with visual hallucinations, fluctuating cognition, and Parkinson's features. So it's not rapid progression with myoclonus or the MRI findings that we see in this stem. Huntington's disease, so this typically presents earlier in life with chorea and psychiatric symptoms, and MRI would show caudate atrophy, not high signal on MRI. Alzheimer's disease, this is wrong because this is a slow progressive dementia without the myoclonus and without the characteristic MRI changes we see here for Creutzfeldt-Jakob disease. Prions disease is another option in the stem, which I've skipped for the end because this is a broader category, but the most specific and correct diagnosis here is Creutzfeldt-Jakob disease. We select our option and submit, and there's an explanation as well. That concludes the video. Thank you guys for staying tuned throughout that explanation. If you are preparing for your AMC examination, highly recommend ACE exam resources. There's a link directly on our pages, and there should also be a link somewhere on this video. Check them out. It's a very affordable, great resource for you guys to use in your preparation. As always, if you guys ever have any questions, feel free to send us a private message or to leave a comment below. See you guys in the next video.